Hello, I'm Dr. Brad Robinson. Today I want to talk to you about the topic on everyone's lips, coronavirus. Specifically, if you're pregnant, I want to talk to you about the potential impact of coronavirus on the baby and or you, the mum. Now, pregnancy is a time of typically increased anxiety and concern because pregnancy is something that a lot of pregnant women haven't done before, or if they have, they haven't done it a lot of times. So when you add something like coronavirus into the mix, it obviously increases levels of distress and alarm and concern. So I want to here today help you be alert, that old chestnut, alert but not alarmed. Now, what is coronavirus? So coronavirus is a respiratory tract infection. It's not dissimilar entirely to something like influenza or a really severe cold. It causes symptoms including potentially fevers, a dry cough, muscle aches and malaise, generally feeling miserable. It can range in severity from being very mild to the point that people have ostensibly no symptoms, or moderate where people might be sick for a week or two, bedbound at home, or it might be severe, and as we've seen tragically, it is claiming a lot of lives around the world. Now, if you're pregnant, how do you contextualize all that? Well, when we think about disease and pregnancy, we think about two things. Firstly, how does the disease potentially affect the unborn baby? And secondly, how does the disease affect the mum? So let's start here with how does the disease affect the baby? Now, I should throw out a caveat here and say this information is all very new. Things are changing rapidly. The virus first came about in November of last year or so. So the data that we're collecting is coming in and things are changing almost hour by hour. But the best information we have at the moment is that there is no risk of vertical transmission of the virus to the baby. So if you're a pregnant woman and you contract coronavirus, there is no evidence at this point that that can be transmitted to your unborn baby. Now, there was a trial coming out of China of 19 women that had coronavirus. They analysed at delivery the amniotic fluid, the placental tissue. They did fetal swabs. They found that there was no evidence of transmission. There was one case in London over the weekend where a woman was very sick with coronavirus and pneumonia, didn't know she had it, delivered the baby, and the baby was subsequently found to have Covid-19. We don't know whether the Covid-19 was passed vertically from the pregnant woman to her baby, or at delivery or postnatally. But at this point, there is no evidence that it occurs during pregnancy. Secondly, let's talk about, does the disease affect the mother more so in pregnancy than it otherwise would? And the simple answer to that is no. So if you're a pregnant woman and you have a carbon copy of yourself that is not pregnant, the pregnant woman is not at greater risk from COVID-19 than her non-pregnant copy. So that's a significant distinction in this virus compared to, say, influenza. Now, influenza in pregnancy is a far greater problem. If you're pregnant, you get influenza, you're far more likely to get severely ill, require hospitalization, or get pneumonia from the disease. COVID-19, that's not the case, so that's also reassuring for women. So women young, fit, healthy, typically enough to be pregnant, therefore, symptomatology you would expect would typically be mild or moderate. Now, I should add at this point, there's been no case reports of fetuses dying from this disease. There's been no case reports of miscarriage from this disease. There's been no case reports of new babies dying from this disease. There's been no case reports of young people dying from this disease. When I say young, I mean under the age of 15, as far as we know. There's been no case reports of pregnant women dying from the disease. So I think that's important to contextualize that. You should be alert, but not alarmed. Sorry for that again. Now, let me conclude by saying, okay, so what can you do? You should be incredibly vigilant. So I don't want to downplay this completely. This is a serious illness and a serious public health issue. You should be absolutely vigilant about a number of things. Hand washing. You should wash your hands with warm, soapy water for a minimum of 20 seconds. Basically until you get sick of doing it. That's when you know you've done it for long enough. Hand sanitizer is good, not as good as warm, soapy water. You should avoid touching your face. That's really hard to do, but if you can, avoid touching your face. You should avoid close contact with other people, so maintain social distancing, so greater than 1.5 meters away from people. You should avoid social gatherings, crowds. So I'm sorry, if you're pregnant, don't go to that baby shower. Don't have a baby shower. I'm sorry, don't go to that wedding. Avoid social gatherings. And again, I know that seems harsh, but this is important. What else can you do? Masks, no evidence that masks do very much at all. So there's not really any point. If it makes you feel comfortable and you have them, sure, but you shouldn't go out and seek them to wear them. Gloves, no benefit. One thing that you can do, absolutely get an early influenza vaccination in pregnancy this time. Now, the new influenza vaccinations are probably going to start coming out early next week, so get that. So if you're pregnant, be aware of it, maintain safety precautions, but just put it all in context that it's likely to be of no great significance to you. Just look after yourself and stay healthy. Thank you.